Nile, you got a question?
Yeah, hi. This is just a general question in terms of the surgical technique. So you said the CPI, the arthroplasty is the more newer technique and the ACDF is the gold standard. So how would you go about deciding between the two? Is it true that mostly the younger patients would be offered the arthroplasty or ACDF, or is it the other way around for older patients? Like how you decide between the two?
Sure. I prefaced it with there's
Can I try to
no.
answer, Dr. McLaughlin?
Sure, go ahead.
So typically you'll order a CAT scan and an X-ray flexion extension to see if there's any significant movement. And if there is instability, I'm not sure if just one level you would do the ACDF, but 2 levels of instability, you would likely do an ACDF to prevent adjacent segment disease down the road.
Excellent. A little bit more. So any instability is a contraindication for a disc replacement. So if there's abnormal movement of that joint, you're going to need to fix it, because that means the abnormal movement probably caused the disc herniation, and putting in a loose device is just it's going to fail. So any instability, we're not going to use it. If there's a lot of arthritis in the facet joints, it's not worth putting in because there's not going to be a lot of movement in the joints anyway. So generally younger person, anybody 50 and under. I haven't placed many in people above 50, but if they have good range of motion, there's no instability, they are a candidate. Now, keep in mind, this literature is still emerging, but there's no definitive study that says arthroplasty is a better long-term solution than anterior cervical fusion. It's theoretically the case. Physiologically, it makes sense, but we're still following the literature on that. I think if it were me, I would want the arthroplasty because you burn less bridges. You can always go back to a fusion if you have to. But again, it would depend on having minimal arthritis in the facet joints and no movement. But that was a good question.